you're blue in the face.
Yeah.
But when you get a result, if you haven't got some sort of treatment that you can offer to solve the problem you've identified, what's the point of testing it?
Yeah.
Okay, we do test saliva
Yeah.
to get to know if there is a problem,
Yeah.
but you have to know how to deal with the problem once you've identified it. And if you identify a buffering issue,
Yeah.
how do you tell a patient to change the buffering capacity of the saliva? We don't really know how to do that, but the CariFree system offers a pH balancing technique that will counteract the buffering capacity in saliva, and there's nothing else out there that does it.
Yeah. I mean, the thing is, there's no point, as you said, no point testing something if you can't sort it out.
Yeah, if you have it, and I mean, the answer we've had to date is put baking soda in a bottle of water and drink that. Have you ever tried that? And at least you can, CariFree does it. I mean, and it's better.
I had a meeting with Ian No,
Yes,
in London, and he was aware of the conference 2 years ago, and he stood up in his lecture and he said, you can get bits and pieces here and there, but he said, you really should look at this system. It's a system.
Oh yeah, it is the only system.
Yeah.
I call it Caries management in a box. Because you get a box and in there is everything you need to manage this disease.
Yeah.
And there's a lot of dentists who really panic and they think, oh, well, if I get rid of caries out of my practice, I'm not going to have any work.
Yeah.
Exactly the opposite thing happens. Because over the years,
Who are you going to go to?
well, I've had a lot of patients who.
How long have you been doing it?
I've been using CariFree since before it even hit the market.
Yeah.
So I was involved with the original testing 5 years ago, and I still remember my very first patient, a young lady, Pauline. She had 16 new cavities, and we explained to her why she had them, and we put her onto the CariFree system, and she has not had another cavity in 5 years.
Wow.
She is totally caries-free.
Well, Melanie, we started 2 years ago. We're a family company, and she started on the CariFree, and I said to her about a month ago, I said, when did you last have a filling? And she said, oh, about 2 years ago.
Yep.
And she's actually resigned from the Denplan. You know, it's the death insurance.
Okay,
Because she's not getting any benefit from it.
Yep.
Because she doesn't have any things anymore.
Once she becomes caries-free and stays that way, all she's got to do is maintain what damage occurred up to that point. After that, no new problems.
And what do you reckon the success rate is if people comply?
If people comply, I haven't seen anyone that it hasn't worked on if they comply. If you're not having success, there's one of two things. There's a risk factor you haven't identified, or they're not complying. It's pretty much it. And so
Which is brilliant, isn't it?
that's really, it narrows itself down to just those two things. You either miss a risk factor, and it might be a medical one, they're not even aware of yet, or it can be behavioural stuff.
Yeah.
But once you or there's sugar in their diet that they haven't identified. Like they don't think, well, I only drink coffee, but it's got 3 teaspoons of sugar, and they didn't tell you that. You didn't.
Like my wife, she had 6 pieces of fruit a day, and it was explained to her. It was really upsetting the balance in her mouth by having one every hour.
Yep.
Much better to indulge.
Yeah, that's what I tell people. Pick out. It's like it's the argument I say. If I give you 7 jelly beans, if I give you 7 jelly beans, there's 2 ways you can eat them. You can eat one an hour and keep the bacteria-producing acid 7 hours, or you can eat them all at once and only have 1 hour's worth of acid production from the bacteria. And it's the snacking and grazing. And I use that jelly bean example. It works really well.
And you were a big advocate of their abrasions, right?
Oh yes, I was involved with their abrasion in the very, very early days of Tim Rainey.
Yeah.
And I still use that every day. Yeah. I just couldn't live without it.
It's one of those things, you never know until you do it.
Yeah.
It was like an advert for Guinness once, and I don't like it because I've never tried it.
Yeah. That's like kids with greens. It's green, I can eat that.
Thank you ever so much.